How do I know if I'm burned out? What is pharmacist burnout? Hi everyone, and welcome back to my channel. I'm Dr. Jessica Louie, and I helped burned out pharmacists and healthcare professionals reset their lives, clear the clutter, and enjoy making memories with their loved ones. Today we're talking about pharmacist burnout. What is it? What is healthcare burnout? Are they the same thing? We are going to talk about 3 things we're looking for in burnout today. Let's get really clear on this so that we can start changing our lives together. What is burnout? It's a syndrome characterized by exhaustion, cynicism, and decreased self-efficacy. What does that all mean? How can you break it down for me, Jessica? Prolonged high amounts of stress will turn into burnout for people. And if you want to know the difference between burnout and stress, you can watch this video as well. For exhaustion, we're really focusing on physical exhaustion, but I also lump mental, emotional, and spiritual exhaustion with it. This means that we never feel fully rested. We have this chronic fatigue, and it may start manifesting as physical symptoms, right? Our physical body will manifest it with GI discomfort, sleep habits that are changing, not getting enough sleep, not being able to fall asleep, all these different things. It could be headaches, it could be things that are manifesting in our physical bodies because of this chronic stress that is now turned into exhaustion and burnout. Cynicism, depersonalization, having this negative viewpoint. Maybe you feel isolated. Maybe you feel that you've lost your ability to empathize with patients or coworkers. Maybe you've lost your enjoyment and are beginning to feel numb about the work that you're doing. Decreased self-efficacy and this low sense of personal accomplishment. Maybe you really doubt that your work is making a difference, having this meaningful contribution to the world. Maybe you question the quality of your work. And maybe you're on this hamster wheel like I was, trying to spin towards this finish line and becoming apathetic. These are the characteristics of burnout. The exhaustion, the cynicism, the decreased self-efficacy that becomes evident in our world. And it can look very different for every person, right? It's not a one-size-fits-all model. And I think that if you're feeling any of these, it's time to start addressing it, right? I talk about it's 10% education and 90% implementation. And we need to implement the simple changes in our lives that will really help reset burnout in our lives. And I personally use the Burnout Doctor method to help you through that process. And I would love for you to come along on this journey together through our YouTube, hit subscribe below, and through our workshops and coaching services. Now, if you're feeling exhausted, feeling like your work is not making a difference, or feeling any of the things I talked about in my burnout story myself, I use very specific examples in that video that you can watch right here. I think that it's great to start educating yourself and then implementing the changes in your own life. And personality traits like perfectionism and people-pleasing and pessimism do play a role in the likelihood that you may burn out if you're not aware of it and acknowledge it. Get the help that you need right here, right now. Implement what we've been talking about. Get our Burnout Doctor Starter Kit so that you can take action in your own life and get that download in your life today. Watch the workshops, apply the knowledge to your life, get one-on-one coaching. Until next time, my friends, spark joy.